Hi, this is Sharon Rennhack, Aphasiatoolbox practice coach and newsletter editor. Today I'm interviewing Dr. Lori Bartels-Tobin, director of the Aphasia Center Steps Forward in St. Petersburg, Florida. Lori's program, the intensive program, opened in June 2008. Welcome, Lori. It's a pleasure to speak with you today.
Hi, Sharon. It's great to be here. Thanks for having me.
Thank you. Lori, some of the research that we looked at indicates that your program is probably one of the most comprehensive aphasia programs. Can you tell us a little bit about that?
And our treatment program is 5 hours a day, and it's largely one-to-one treatment with a licensed therapist, and our programs range anywhere from 4 to 8 weeks. The price range is typically from the 4-week at $16,000 to the 8-week at $32,000. The 2-week is available. It's more designed for people who need kind of like an interval boost that have been to an aphasia thing before, that need to come in and get a little bit of extra practice or maybe some new treatment methods and materials so they can keep making progress. In general, it's, like I said, the $16,000 to the $32,000.
What is your clinical approach?
Well, I think the most important thing is that we really believe that there's no plateau, that there's no such thing as, okay, there's nothing more we can do with you and you can't get any better. So we think that everybody can make improvements and learn to communicate better within the family or even outside of the family. So when families come here, we treat the family as a whole. So we do aphasia treatment and strategies, but we also do counseling and education, and we focus on goals that are important to the family, and treatment materials are specifically geared towards things that the clients are interested in, like hobbies, work, family. They get homework every day, and when they're discharged, they get a lot of material and specific recommendations so that they can keep working on their goals even after they leave here. So I would just say our clinical approach is there's no one-size-fits-all. Every person with aphasia is different, and every person with aphasia, no matter how long it's been since you had your stroke or since you had your last treatment, you can always keep making improvement if you're motivated to do it.
Very good. Lori, can you tell us a little bit about some of the outcomes?
Well, like I said, each person with aphasia is different, so each person's recovery is different. Now, every client that's come here makes progress. It doesn't depend on their age or how long it's been since their stroke. Depending on kind of the severity when you come in, depends on when you have a very severe aphasia, we really have to fill in a lot of the foundation for speaking and understanding. Whereas if you have a milder or a moderate type of aphasia, we can work on more specific areas that can help you get back to work or back to college. We do have several case studies that are available online so that people that are interested in the program can look at the case by how old that person was or what type of aphasia or how long it's been since their stroke, and they can kind of compare and say, oh, that person, you know, is kind of similar to the aphasia that I have or to my age, and this is the kind of progress that they made. So we aim for specific outcomes, like things that are important to people, like being able to order for yourself at a restaurant, being able to take a phone message, being able to pick up your prescriptions at the pharmacy, or, you know, even more specific, have a conversation with your family while we're treating the overall aphasia. So we're working on the aphasia, but we're also working on specific communication things within the aphasia so that we can meet those goals more quickly and help people get back to things they want to do in life. I think that we have a very good program, and I encourage people to look into intensive aphasia therapy.
Lori, thank you very much for a very insightful interview.
Hopefully it'll give people, you know, the pieces of information that they are looking